Hi everybody, I'm Susan Eichorst, physician assistant here at Atagi Aesthetics. I practice medical wellness and bioidentical hormone therapy with Tanya Atagi. I appreciate you joining in today. We're going to go over a couple pretty common issues or items that come up in most of my conversations with my patients and that many people have questions about. We're going to be doing a Facebook Live not only today, but the next 3 Wednesdays in a row, same time, 12:30. Today I'll be focusing on hormones in general and in specific vitamin D3, which is actually a pro-hormone or which converts to a hormone in the body, and its best friend, vitamin K2. Next week we'll talk about the differences between bioidentical hormone replacement therapy and traditional synthetic hormone replacement therapy. That'll be primarily information for postmenopausal women, but many women that I see are also peri or premenopausal that can benefit from having their hormones balanced. The week after that, week 3, we'll talk about a pretty cool compound called diindolylmethane that is DIM and its role in estrogen metabolism for both women and men. And lastly, the last in this series, we'll be talking about the microbiome, or this pretty cool array of bacteria that you and I live with, roughly 3 to 4 pounds of bacteria actually that we carry around, and its importance and why we want to keep that so healthful. So today we're going to start with what are hormones. We talk about this as far as it's all the rage now, getting your hormones balanced, making sure things are balanced for us. Hormones are actually chemical messengers, and the word hormone comes from a Greek word, hormone also, but it is to set in motion or to urge on. And that makes a lot of sense because these messages are sent from one part of the body, transferred or transmitted through the bloodstream, and are picked up in another part of the body where they are utilized to help those cells function better. So many of us know about thyroid hormones, that's one, and we'll talk about that in a later series. But thyroid hormones are manufactured in the gland, in the neck, right about in here, and then sent out into the body where they are picked up in other cells that then activate them to increase our body temperature, help with some of our metabolism, help our brain think clearer. So that's one type of a hormone. Sex hormones, estrogen and progesterone for women, testosterone for men and women, and then not uncommonly we talk about cortisol and adrenaline as well as our stress hormones, although there's lots of other hormones, but those are the primary ones that we think about. So hormones are really just chemical messages, and we want our body to have success with how we function at our optimum, and that's where these hormones come in. So today we're going to focus a little bit more just on vitamin D3. This gets a little confusing for a lot of people because of its name, but it's not technically a vitamin. Vitamins are essential for our life, but vitamins we get through outside sources only. We cannot make our own vitamins. We need something else to get that into our system. Hormones, on the other hand, we actually have the ability to make those. And so vitamin D3 is converted through sunlight. It converts cholesterol in our skin to make D3. D3 then goes on in our liver and our kidneys to make an active hormone called 25-hydroxyvitamin D3. But most of us are not walking around naked, getting pink in the sun for 20 minutes every day like our ancestors may have been thousands of years ago. So really the best way to get vitamin D nowadays is through a supplementation. And then it goes through that process in the liver and the kidneys, and we end up with an active hormone. The reason vitamin D is so important is it has a huge role in how our bodies function. We know that vitamin D is super important for getting our bones strengthened, and I will talk more about K2 in a moment because they absolutely go hand in hand. But also, good levels of vitamin D can aid in weight loss because it increases our fat-burning metabolism. We know that it downregulates when we have an overactive immune system, as found in autoimmune conditions. Super important for diseases like multiple sclerosis, but we do know that vitamin D plays a huge role in all autoimmunity as well. Better levels of vitamin D decreases our hunger and cravings, decreases cell proliferation, as we find in cancers. Cancers is kind of a revved up amount of cell turnover, and vitamin D can decrease that and stabilize that. We've seen decreased hypertension when we get patients on good vitamin D levels, decreased osteoporosis because of the bone component, and we see increased serotonin levels with vitamin D supplementation, which then results in decreased depression, or at least improvement in depression medications for those patients taking them. We can get some vitamin D from foods. It's not as easy to get them that way than they are through supplements. Fatty fish is one option. We have to be cautious with our fish supply because much of our fish is contaminated with plastics and mercury. But salmon and mackerel are good sources for vitamin D. We can get it from beef liver, from cheese, and from egg yolks. Those are all very good sources for it, but usually not enough to really get those levels up where we want it. Having said that, normal levels for vitamin D, and it's the 25-hydroxy vitamin D level that we measure in the blood, when those come back, those normal levels go anywhere from 30 to 100. That's fine, but those are normal levels, really optimal levels that we've started to hone in on by the colleagues that I follow is 60 to 80 as being an optimal level, and some integrative psychiatrists have even found 80 to 100 for their patients with depression have made huge differences on how their meds work and how they may even feel even off their meds. So vitamin D is really something that not only needs to be checked, but really should be counseled on being adequately supplemented for so that you get the levels that you deserve. The next piece of that equation, though, is really vitamin K2. And here this is a vitamin. We get the K2 from an outside source. Generally speaking, we don't get a lot of K2, but first I want to clarify what vitamin K is. There are definitely people out there that are familiar with K because they are on blood thinners and may have been told to avoid dark green leafy vegetables because of the vitamin K component. What that really is referring to is K1. Vitamin K1 is a form of vitamin K that acts only on the clotting aspect. It promotes clotting, so when people are on blood thinners, they want to be cautious about taking vitamin K1, but it really has very little to no impact on bone health. Vitamin K2 is another form of vitamin K, very different from K1, has virtually very little impact on the clotting cascade at all, but it has huge implications for heart health and for bone health. Vitamin K2 is super cool because it will help to release calcium that is sitting in our soft tissue, which, if that's my baby finger, I don't care so much about because that's not going to accumulate to really any damage for me. But if it's in my coronary arteries, can have a huge implication on how I calcify my body over time. So K2 actually helps release enzymes that will release that calcium from the soft tissue in those vessels and help deposit it in the bone with the vitamin K2. With the D3. So they really should always be taken hand in hand. They're fat-soluble vitamins, they work best with a meal, but they should always go hand in hand. The last piece of that equation that I just need to mention is calcium. There's a large amount of discrepancy and information out there about should we be on calcium supplementation, do we need calcium supplementation. The one part I do know is that calcium supplementation in and of itself alone is not what helps build bone. D3 and calcium can help build bone, but it doesn't address the added calcium that's sitting around in our bodies. So that's really where the K2 comes in, and you really want to make sure that you're getting anywhere from 200 to 500 micrograms of vitamin K2 when you do take D3. So to recap, hormones are super important. They're a lot of fun. They're really great to balance, and people do feel great relief from them. D3 is actually a hormone, but does need to be taken with vitamin K2. So hopefully that clears up some questions that people have about the mysterious vitamin D3 and K2. And stay tuned for further adventures in hormone balancing and medical wellness as we move forward with this Facebook next week. Thanks for joining.